Welcome back to Monday Musings. This is Ryan DeWitt from DeWitt Physical Therapy. Today I wanted to talk about the healthcare system and kind of what we think about it, where we fit into it, and what we think it should be. So in a traditional model, the healthcare system should be for the health and general well-being of people, right? But I think, and this, try not to hear this as like totally knocking it, our healthcare system is really set up to diagnose and find things, and like that's what's going on. And a lot of times that is almost more like sick care. Like we're trying to find something that's wrong with you. You're sick, we can find this thing, and then we come up with a way to treat it. And we have these normative values for whatever not sickness is. I'm not going to say health, because that's different. We're going to talk about that in a second. But what not sick is. And if you fall below or around those or outside of those levels, then you are considered ill or sickness, right? In some sense of the word. So the Western system is really good at identifying sickness, not health. Unhealthy markers, right? So we're talking like our cancer or diabetes, cardiovascular disease, like those kinds of things. There are these really big problems. In the orthopedic world, it's like, yep, you got a rotator cuff tear, or you have a ACL tear, or you got arthritis, you need your knee replaced, or something along those lines, right? So again, I think we're really good at identifying that. But I think healthcare should be more than just not sick care. Like that doesn't really get people to where they want to go, or how they want to feel, or the things that they want to be able to do. And that is where we really need to think about healthcare is kind of like the way that the system is set up is different than actually providing wellness. And wellness is where like I'm here, maybe I've been to my doctor, maybe I've talked to these people and they can't find anything wrong with me. Like how discouraging is that as a patient, and I've totally been there. So for what it's worth. So it goes beyond just like, I can't find something, apparently I'm healthy, but I feel poopy and I don't feel like doing the things I want to do, or like this hurts, but nobody can find anything. I don't know how many times I've heard this as a healthcare practitioner, as a PT, as a coach, all these things. And what I really think that we should be doing, we collectively, and especially in the rehab world, because we are uniquely positioned to work with patients one-on-one towards wellness. They have an injury or something like that, and it is our job to get them back to normal. But normal for everybody can be like, within these certain parameters, or I have normal patients that compete at the CrossFit games and surf big waves. Do we understand that may not be normal to everybody? And that's fine, but we got to figure out what your normal is, and we also got to figure out how do we build a bridge back to that. But again, sometimes getting back to just what the industry considers to be normal isn't super functional. It's not where our people really want to be, because that's below the level, like below their threshold level of where they should be in their opinion, and where they ultimately want to be to have a high quality of life. So again, as PTs, we talk to people about all kinds of things. We really take the time to explain, in the context of rehab, how is their diagnosis going to functionally impair them for life, or will it? Or is it something that like, hey, you got this on your MRI and we just got to get you functional and doing more, and like chances are you can live a long, healthy, active life with this thing. But also in talking about concepts like breathing, sleep, nutrition, fitness. How can we bridge the gap all the way up to performance? Like how can we do that? And that is where we really come into the concept of wellness. So again, not sick care, it's great, healthcare, but then where does this wellness come in? Because that's not something that a lot of times insurance really wants to pay for. But here's the thing. I believe, and I am an active participant in the healthcare community, and even in the wellness community as the services that I provide, but the services that I seek out. So I am speaking from my opinion, is again, we are uniquely positioned to be able to help our patients bridge that gap, have the conversations that nobody else is having. And even if we don't have the answers, be able to say, I know a nutritionist you can go see. I know a sleep person you can go see. I think you should have you tried meditation? Like maybe this could be really helpful for you. And having these different conversations that should kind of round out the package of wellness to really get people feeling their best, moving their best, and performing their best through physical therapy. And if your insurance company doesn't cover that, because they only want to get you to a certain point, then maybe that's something that's worth paying for out of pocket. I know personally, I've paid out of pocket for a lot of my wellness services, and I feel really good about that decision. But that's also what we're trying to move into, is like, how can we be a better resource to help answer some of those questions, or help better be able to guide our patients into where do I go for X? And so again, these are conversations that we have with our patients all the time. These are, everybody wants to feel their best, move their best, and perform the best. So we are working at trying to help you guys do that. And again, a lot of the conversations we have are guided towards all of those goals. So if you guys have any questions about how we can help you, go ahead and reach out to our office. We can always set up an appointment. We can talk with you. Again, sometimes it's you just need really good, high quality advice. And I think that's one of the things that we specialize in the most.